Five elements theory, application in TCM2. There are other therapeutic methods applied according to the generating cycle that maybe include the following. The method of replenishing water to nourish wood. This method is also called replenishing the kidney to nourish the liver. It is a method to nourish the liver by supplementing the kidney so as to astringe liver yang, and is mainly suitable for liver-kidney yin deficiency or liver yin deficiency and liver yang uprising. The method of reinforcing earth to strengthen metal. It is also called invigorating the spleen to benefit the lung. It is a method to replenish lung qi by replenishing spleen qi, and is mainly suitable during an insufficiency of both the spleen and the lung due to the lung qi deficiency or spleen and stomach deficiency. The method of assisting fire and strengthening earth. It is also called warming the kidney and strengthening the spleen. It is a method to support spleen yang by warming and strengthening kidney yang, and is suitable for a syndrome of yang deficiency of both the spleen and kidney, or a part of patterns of spleen and yang deficiency. It should be pointed out that in terms of generating law, among the five elements, heart belongs to fire and spleen to earth. Fire failing to generate earth should be understood as the failure of heart fire to promote spleen earth. However, since the time when the theory of life gate was established, there was a change in this concept. Clinically, the fire refers to the kidney yang or life gate fire and seldom means the heart fire anymore. The method of mutual generation of metal and water, a method of nourishing both lung and kidney yin. It is called as the method of lung nourishing and kidney tonifying, and is mainly suitable for the case when insufficient lung fails to distribute the fluid to nourish the kidney, or the case of yin deficiency of the lung and kidney due to the kidney yin deficiency with failure of essence qi to go up to nourish the lung. The therapeutic principles and methods according to the restriction law. The therapeutic principles selected according to law of restriction include restricting the strong and strengthening the weak. Restricting the strong. This is a therapeutic principle to restrict the hyperactive viscera. For example, if the liver qi gets disordered, it can transversely affect the stomach or spleen and lead to a disharmony of the liver and the stomach, or disharmony of the liver and spleen. The therapeutic method is to soothe or restrict the liver. Strengthening the weak. This is a therapeutic principle to support the functions of the viscera being either over-restricted or counter-restricted. For example, if the insufficient kidney yin, water, fails to restrict the heart fire, it is called disconnection between the kidney and the heart. The clinical manifestations are soreness and weakness of the lower back and knees, insomnia, spermatorrhea, and so on. The treatment should be nourishing kidney yin along with sedating heart fire. The therapeutic methods selected according to the law of restriction include the following. Inhibiting wood to assist earth. It is also called smoothing the liver and strengthening the spleen. This is a method to treat the case of failure of the insufficient spleen in transformation and transportation due to hyperactivity of liver qi by soothing the liver and strengthening the spleen. It is mainly suitable for the pattern of excessive depressed liver over-restricting spleen. Supporting earth to restrict water. This is a method to treat the case of accumulation of water dampness by warming and strengthening spleen yang, or strengthening the spleen and warming the kidney. It is mainly suitable for the edema due to the spleen deficiency failing to transport and transform the water dampness. Earth here refers to spleen, while water means damp pathogen. The definition is a little different. Assisting metal to subdue wood. It is also called subduing the liver and clearing the lung. This is a method to inhibit the hyperactivity of liver fire by clearing and purifying lung qi. It is mainly suitable for the case of excessive liver fire affecting the clearing and descending of lung qi, sedating the south and tonifying the north. It is also called a method of fire sedating and yin nourishing. South refers to fire and north water. This method is to sedate heart fire and nourish kidney water. It is mainly suitable for the case of kidney yin deficiency and heart fire excess. This syndrome is also called disconnection between heart and kidney. So the guide and treatment for mental disorder. The emotions originate from the 5 Zhang Viscera, and among the latter, there are relationships of generation and restriction. Therefore, there are the same generating and restricting relationships among the emotions. Clinically, by applying these restricting relationships, the emotional disorders can be regulated and the disease can be treated. This method is called the restricting and non-restricting laws of the 5 emotions. Sorrow is the emotion of the lung that belongs to metal, while anger is the emotion of the liver that belongs to wood. Therefore, metal can restrict wood and sorrow can restrict anger. Fear is the emotion of kidney, of the liver. Therefore, the emotion of the liver belongs to wood, right? Is the emotion of the spleen that belongs to earth. Therefore, wood and anger can restrict sensitivity. What is the emotion of the heart that belongs to the fire? While worry is the emotion of the lung that belongs to metal. Therefore, fire can restrict metal and joy can restrict worry. Pensiveness is the emotion of the spleen that belongs to earth, while fear is the emotion of the kidney that belongs to water. Therefore, earth can restrict water and pensiveness. Thank you for your attention.
Now let's discuss interviewing the patient, the TCM patient, on nose and sinuses. Sneezing is a sign of rebellious lung qi. The nose is an aspect of the lung, and the lung sends qi downwards. If the sneeze is acute, it will usually be due to invasion of exogenous pathogenic qi. The exudations from the nose will usually be clear and watery if there is wind cold. If there is wind heat, the nose will be more blocked and exudations will be yellowish and thicker. If there is toxic fire, the exudations will be thick and greenish, and they will smell and taste foul. There may be a chronic condition of runny nose with clear, transparent, and thin mucus. This is seen in damp phlegm conditions. Phlegm heat can result in both an acute or a chronic blocked nose and sinuses. The mucus will be yellow or white, and it will be thick and sticky. If there is toxic heat, the mucus will be greenish and thick. Both liver fire and stomach fire may be involved in phlegm heat conditions, manifesting in the nose and sinuses. Fire conditions can also agitate blood so that it ruptures the walls of the vessels in the nose, resulting in blood in the mucus. If there is lung qi deficiency, the lung can easily be invaded by exogenous pathogenic qi. This can manifest as a chronic condition where the person sneezes after the slightest contact with the exogenous pathogenic qi. So we have here a tabulation for coughing, dyspnea, black or runny nose. When one observes loud cough with white or clear sputum, this means wind cold, damp phlegm, phlegm cold. If the patient would have loud cough with yellow sputum, this signifies wind heat, phlegm heat. Loud and explosive cough would mean excess condition. Barking cough is excess heat. Dry or ticklish cough is lung yin deficiency, dryness. Weak cough would be deficient condition. Weak cough with scanty phlegm, dry rubbery sputum, or no sputum would be lung yin deficiency. Cough with sticky sputum that is difficult to expectorate, there is excess heat in the lung. Loose, clear, or watery sputum would mean phlegm cold, damp phlegm, phlegm fluids. Cough worst in the evening and at night is lung yin deficiency. Cough worst in the morning would be phlegm. Cough worse when person speaks or is tired, lung deficiency conditions. Cough worse after consuming dairy products, phlegm. Shortness of breath, easily breathless, lung qi deficiency, lung yin deficiency, kidney deficiency, phlegm qi stagnation. Difficulty breathing, phlegm, lung qi deficiency, stagnation of qi, blood stagnation in the lung, and invasions of exogenous pathogenic qi. Wheezing or rattling sounds in the chest is phlegm. Desire to yawn or sigh is qi stagnation. Feeling that there is a heavy stone on top of the chest would be phlegm. Difficulty breathing in deeply because the chest feels tight is qi stagnation. Sneezing is invasion of exogenous pathogenic qi or lung qi deficiency. Runny nose with clear watery mucus, wind cold, damp phlegm. The nose or sinuses are blocked with yellowish or greenish mucus, wind heat, phlegm heat, toxic fire. Blood in the mucus would mean fire. Thank you for your attention.
Let's now continue with diagnosis according to pathogenic qi with a pattern exogenous dryness. Dryness is the prevailing qi in autumn. While it is quite logical that cold is defined as being the prevailing qi in winter, it seems less logical in the northwestern Europe that dryness should be the prevailing qi in the autumn. Autumnal weather in Britain is often very damp. The reason that dryness has been ascribed this definition is that in autumn, many parts of China are extremely dry because the prevailing wind is from the west. The Gobi Desert is located in West China, which means that the air is extremely dry. Furthermore, autumn is the season of the metal phase and west is the compass direction of this phase. Dryness is extremely deleterious for the lung, which is the metal phase organ. In addition, dryness has a resonance with the Yangming aspect, which the metal organ and channels are a part of. Constipation and dry stools are a classic symptom of dryness in the body. The British Isles have a damp climate because of their geographical location. This means that external dryness has not traditionally been a problem here. Invasions of dryness can, however, be observed in people who live and work in buildings that have a very dry indoor climate, such as buildings made of concrete. Dryness is defined as being yang. This is because the dominant negative effect that dryness has is that it desiccates and injures fluids. That is, dryness injures yin. The most typical manifestation of an invasion of dryness are dry mucous membranes, dry throat, dry eyes, dry mouth, dry nose, dry stool, and sparse urinations. A distinction is made between the exogenous and internally generated dryness. Interior dryness is a precursor of yin deficiency. Exogenous dryness has its etiology in exposure to an excessively dry climate. The symptoms and signs are as follows: dry throat, dry lips, dry mouth, dry eyes, dry skin and mucous membranes, dry tongue, and a superficial pulse. The key symptoms here are dry mucous membranes and superficial pulse. For our treatment principle, we expel dryness. And we may choose from LI4, LI20, lung 7, kidney 6, and gallbladder 20, and use drainage apart from kidney 6, which should be tonified. LI4, lung 7, and gallbladder 20 expels exogenous pathogenic qi and activate the wei qi. Li20 circulates qi and yin in the nose and expels pathogenic qi. Kidney 6 nourishes yin and yin. The person should avoid places where the air is very dry. Exogenous dryness can be caused by the following patterns of imbalance: wind heat and yin deficiency. In turn, this can result to yin deficiency. Thank you for your attention.
Diagnosis according to 6 stages. Shaoyin cold stage. Shaoyin stage. The Shaoyin stage is more critical than the previous stages. When Qi has penetrated this far down, it has started to injure the heart and kidneys. These organs' yang or yin aspects are weakened, and Zheng Qi is not able to resist Xie Qi. The Shaoyin stage pattern can occur because exogenous Xie Qi has penetrated to this depth from one of the other stages, and when exogenous Xi Qi directly invades the Shaoyin aspect. A direct invasion can occur if a person who is Yang Shu or Qi Shu sweats profusely whilst being exposed to the cold. The symptoms and signs that define the Shaoyin cold and Shaoyin heat patterns are dependent on the nature of the Xie Qi and on which aspect of the kidneys are deficient. Shaoyin cold stage. The symptoms and signs in this pattern reflect the kidney yang is burdened and weakened. This will be seen in the fact that many of the functions that yang performs will be compromised. Kidney yang supports spleen yang in its function of transforming the food and fluids that have been ingested. This means that there can be watery diarrhea containing undigested food when there is Shaoyin cold. The diarrhea will typically occur early in the morning, just after the person has woken up. It can, in fact, often be the reason that the person wakes up very early in the morning. The depletion of yang will weaken the production of qi, resulting in fatigue. Kidney yang is the fundamental driving force in all fluid physiology. When there is kidney yang shu, there will be visible edema, a lack of thirst, and frequent urination with copious amounts of clear urine. Sometimes the urination and diarrhea will be so frequent and copious that the person, instead of lacking thirst, will have a pronounced thirst due to dehydration. Yang shu will also be evident, and the person will feel cold, will have an aversion to cold, and will dress warmly. Their arms and legs will feel especially cold. They will sleep in a curled up position beneath a thick quilt. The person will have a preference for warm foods and drinks, and they will have an aversion to cold food and drinks because the ingestion of cold substances will aggravate their symptoms. The heart yang shu aspect will manifest with a lack of motivation, lethargy, and indolence. The etiology is the Shaoyin cold syndrome can develop from multiple etiologies. There can be a direct invasion of cold into this aspect of the body, especially if the person is already heart yang shu or qi shu and is invaded by exogenous wind and cold will sweating. Cold xie qi can sometimes be so powerful that it quickly overcomes the resistance of the body's zheng qi and penetrates into the interior aspects of the body. Because the xie qi is cold in nature, it will damage the body's yang aspects. If the person is kidney or heart yang shu, this process will be quicker. There can also have been repeated invasions of exogenous cold, which eventually weaken kidney yang. This is particularly relevant if the person does not rest enough during and after an illness. Symptoms and signs are aversion to cold, sleeps in a curled up position, cold limbs, diarrhea containing undigested food, watery vomit, nausea, loss of appetite, fatigue, mental lethargy, copious amounts of clear urine, frequent urination, lack of thirst with a preference for hot drinks, and there can though sometimes be a profuse thirst if severe diarrhea has damaged fluids. White or pale face, preference for hot drinks and food, and the tongue will be pale and wet with a white coating, and the pulse will be deep, weak, and slow. The key symptoms are aversion to cold, frequent urination, deep, slow, and weak pulse. The treatment principle, warm and tonify kidney and heart yang. The acupuncture points to choose from are kidney 3, kidney 7, heart 5, bladder 15, bladder 23, do 4, ren 4, and ren 6. The needling technique is to tonify and moxa is necessary. The explanation is kidney 3, kidney 7, and bladder 23 tonify kidney yang. Do 4, ren 4, and ren 6 tonify kidney yang and yuan qi. Heart 5 and bladder 15 tonify heart yang. Relevant advice. The patient will benefit from eating and drinking things that are warming in their energy and temperature, whilst avoiding things that are cooling. Ginger, garlic, and cinnamon will be particularly beneficial. They should ensure that they keep warm and avoid getting cold. It is important that they rest and do not overexert themselves. The Shaoyin cold pattern can be caused by the following patterns of imbalance: Tai Yang stage, Tai Yin stage, kidney yang shu, heart yang shu, spleen yang shu, and the Shaoyin cold pattern can result in the following patterns of imbalance: Juan pattern, Tai Yin pattern, kidney yang shu, heart yang shu, and spleen yang shu. Thank you for your attention.
Let's discuss balancing distal and local points. Distal points part 2. As mentioned above, distal points are not only those on the channel involved. For example, in an eye problem deriving from the bladder channel, distal points would be those on the other extremity of the bladder channel on the foot. However, LI4 would also be an effective distal point because it is a point that is used as a distal point for all problems of the face. In particular, when distal points are selected, the close connection between the channels of the same polarity, for example, greater yang, the small intestine and bladder, lesser yang, the triple burner and gallbladder, bright yang, the large intestine and stomach, greater yin, the lung and spleen, lesser yin, heart and kidneys, and terminal yin, pericardium and liver would be borne in mind. These channel pairs unite corresponding arm and leg channels of the same polarity and same potential. This pairing means that distal points of paired channels may affect the same areas. For example, in ear problems stemming from the triple burner channel, the applicable distal points are points in this channel below the elbow, especially TB5 and TB2. Okay. However, due to the close connection between the triple burner and gallbladder channel within the lesser yang pairing, points on the gallbladder channel below the knee may also be selected as distal points for the ear problem. Example GB43. Thus, the distal points of paired channel are almost interchangeable. For example, TB2 and GB43 for ear problems, LI4 and stomach 44 for gum problems. However, it is interesting to note that such connection and interchangeability is closer for the yang than it is for the yin channels. The reason for this is that while the yang channel connect directly and superficially on the head or face, the yin channel connect on the chest or abdomen, but only at a deep level. Thus, we can look upon the yang channel, for example, greater yang of small intestine and bladder, almost as a single channel joined directly and superficially on the face. So we could look upon the large intestine and stomach channel, for example, as one channel from this point of view. The same applies to triple burner, gallbladder, and small intestine bladder. So we have here the illustration of the cycle of qi circulation in the 12 channels. And here, the qi circulation between the head and the chest So as illustrated from the stomach, it goes down to the spleen, then back to the lung, and goes to the large intestine and back to the stomach. Thus, in the case of the young channel, we have a choice of distal points to use, either on the hands or feet, as the points are quite interchangeable. When there is such a choice, we should bear in mind that the distal points of the legs have a stronger effect than those of the arm. For example, for stomach heat affecting the gums, stomach 44 has a stronger effect than LI4. For the yin channel, it is somewhat different. The yin channel all end or start in the chest or abdominal cavity, and they do merge into one another, but only internally, whereas the yang channel merge into each other directly and superficially on the face. Thus, in the case of yin channels, we do not have the same free choice of distal points as for the yang channels. For example, PC6 and liver 3 have some common properties insofar as they both move liver qi, but besides that, they have quite different actions, and there is not really a question of choice between them as a distal point. Finally, with regards to the local area affected by distal points, there is an important general principle that states that the farther the farther away a distal point is from a given area, the more it will influence it. For example, if we take a long channel such as the stomach channel, stomach 45 and stomach 44 will affect the other end of the channel, that is the eye and forehead. Distal points slightly farther up, such as stomach 41, will affect a lower section of the other end of the channel, that is the throat, as illustrated this principle in figure 70.8. So we have here the areas affected by distal points. From the lower leg, it can influence the affected area on the chest, neck, and head. Distal and local points. Local points are those in the head and trunk. Distal points are the points on the arms and legs below the elbow and knees. The arm and leg points of channel of the same polarity and potential, example, greater yang, greater yin, are almost interchangeable. For example, liver 4 and stomach 44. Leg distal points are stronger than the arm distal points. A distal point may be on a channel different to the channel where the local problem lies. For example, liver LI4 for the bladder channel eye problems. Thank you for your attention.
Diagnosis according to Zhang Fu organ patterns. Food stagnation. Food stagnation is often an overlooked aspect of a diagnostic picture, particularly in chronic and complex cases where there are many patterns intertwined with each other. Food stagnation, like phlegm and shoe stagnation, is often a cause and consequence of many chronic patterns of imbalance. This is because many patterns of imbalance can directly or indirectly disrupt the stomach and spleen's qi mechanism. Chronic food stagnation will also, in the long term, directly and indirectly lead to imbalances in many other places in the body. The foundation of food stagnation is often laid as early as the first year of a person's life. This will be the case if there was an improper diet and if the baby was repeatedly fed before the stomach had been emptied of food. There will often be vague and subtle signs of food stagnation rather than outright symptoms. Typically, the patient will have a slight sensation of fullness in the belly or bloating for some time after they have eaten, will burp or belch, and will have discomfort in the epigastric region. There can often be a vicious circle where food stagnation causes the creation of stomach heat, which results in annoying hunger. The person then eats constantly and the stomach never completely empties, so even more stagnation of food in the stomach will arise. The etiology of food stagnation arises directly from eating too much at a time, eating too fast, not chewing the food properly, eating too late at night, constant snacking, eating while stressed or whilst working, eating while sitting in a twisted position, and eating food that is difficult to transform. If the spleen and stomach are also qi-shu, food will not be transformed. If there is damp and phlegm, this will weaken the spleen and block the stomach and spleen qi mechanism so that the food stagnates. Liver qi stagnation can also disrupt the stomach and spleen qi mechanism with food stagnation as a result. Yang shu can mean that there is not enough physiological heat to transform the food. Yin shu and heat can lead to transformation of phlegm that will then block the stomach and spleen's qi mechanism. The symptoms and signs are lack of appetite, a full sensation in the epigastric region, epigastric discomfort, bad breath, belching that often tastes or smells of the food that has been eaten earlier, acid reflux, vomiting, abdominal bloating, discomfort when palpating on the upper abdomen, bloating and abdominal discomfort that is relieved by vomit, insomnia or dream-disturbed sleep, feeling hot at night, loose stools or constipation, the stools smell rotten or of sewage, odorous flatulence, thick and greasy tongue coating, slippery or wiry pulse, especially in the right one position. The key symptoms are full sensation or discomfort in the epigastric region, belching that tastes of previously ingested food, thick, greasy tongue coating. The treatment principle would be dissolve food stagnation and regulate stomach qi. And our acupuncture points to choose from: stomach 19, stomach 21, stomach 34, stomach 36, stomach 44, spleen 4, Ren 12, Ren 13, and pericardium 6. You should have a draining needling technique. The explanation, more so, is stomach 19, stomach 21, stomach 34, stomach 36, spleen 4, Ren 12, and Ren 13 to regulate stomach qi and dissolve food stagnation. Stomach 44 dissolves food stagnation, regulates the stomach qi, and drains heat, while pericardium 6 regulates qi in the middle jiao. And for some more relevant advice, it is crucial that a person with food stagnation regulates the way they eat and what they eat. They should not eat too quickly or too much at a time. They should sit upright when eating and chew their food well. They should eat food that is easy to transform, and they should not eat too late in the evening. Stroking downwards with the fingers from Ren 16 to Ren 8 will help stomach qi and the ingested food to descend. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Food stagnation can be caused by the following patterns of imbalance: spleen qi shu, stomach qi shu, spleen yang shu, stomach yin shu, stomach qi stagnation, damp, phlegm, liver qi stagnation. The food stagnation can result in the following patterns of imbalance: spleen qi shu, stomach qi shu, stomach fire, stomach yin shu, damp heat, phlegm fire, stomach qi stagnation, and liver qi stagnation. Food stagnation in the stomach. Etiology is overeating, eating too quickly, eating while worrying. Underlying and accompanying pathology: obstruction of food in the stomach, preventing stomach qi from descending, stomach deficient and cold, phlegm, heat, fire in the stomach. Their signs and symptoms: epigastric pain, fullness and distension, discomfort alleviated by vomiting or passing stool, nausea and vomiting fluids, halitosis, sour reverberation, belching, insomnia, diarrhea or constipation, and poor appetite. The pulse will be full and slippery. The tongue shall be thick with thick coating which is either white or yellow. The treatment principle is to harmonize and stimulate the sending of stomach qi and moves food stagnation. So acupuncture treatment, Ren 13, stomach 21, stomach 45, pericardium 6, Ren 12, Ren 10, stomach 44, spleen 4, stomach 19, and kidney 21. Thank you for your attention.
Let's discuss yin and yang imbalances under diagnosis according to Qi Shui Jianye imbalances. Key symptoms are fatigue, pale tongue, and weak pulse. Treatment principle is to tonify the qi, and we have to choose from the following acupuncture points: stomach 36, spleen 3, spleen 6, bladder 13, bladder 20, bladder 21, bladder 23, lung 9, kidney 3, Ren 4, Ren 6, Ren 12, Ren 17. Tonifying technique, Moxa recommended. Stomach 36, spleen 3, spleen 6, bladder 20, bladder 21, and Ren 12 tonify spleen and thereby the production of post-heaven qi. Lung 9, Ren 17, bladder 13, tonify lung and thereby the production of post-heaven qi. Kidney 3, bladder 23, Ren 4 tonify kidneys and thereby pre-heavenly qi. Ren 6 tonifies yuan qi. When there are qi deficiency conditions, it is important that the person ensures that the air that they breathe and the food that they eat are qi tonifying. They must ensure that they do not consume more qi than they produce. In practice, this means that they need to eat a diet and eat in a way that tonifies spleen qi. That is, foods that are fresh, easily digestible, prepared, and warm. They should eat small, frequent meals. They should avoid foods that are cold and hard to digest and have not been prepared. Soups, pureed vegetables, and stews are particularly recommended. They must also eat slowly and chew their food well. Lung qi is tonified by fresh air and breathing exercises. Qigong, Tai Chi, and yoga will be beneficial as they tonify and circulate qi at the same time. Caution should otherwise be observed with regards to physical activity, fitness training, and sport. It is important that the person does not engage in activities that make them feel tired. On the whole, they must ration their energy and avoid working too much and for too long. Men who are kidney qi deficient should avoid having ejaculations. Qi deficiency can be caused by lung qi deficiency, spleen qi deficiency, kidney qi deficiency, invasions of pathogenic factor, blood deficiency, phlegm dampness, yang deficiency, jing deficiency. And qi deficiency can result in blood deficiency, phlegm dampness, qi stagnation, blood stagnation, yang deficiency, and yin deficiency. Thank you for your attention.
Let's discuss more acupuncture points as we continue to tackle depression. First up, we have pericardium 6. Pericardium 6 is an extremely important point for depression. It is always used in modern China for mental depression. It treats especially depression deriving from liver qi stagnation in two ways. First, it moves liver qi due to its connection with the liver channel within the terminal yin or the Julian channels. Second, it treats the mind or the shen due to its close connection with the heart. Indications for this point include insomnia, manic behavior, poor memory, anxiety, fright, sadness, and depression. Next up, we have triple burner 3. Through experience, triple burner 3 moves qi and eliminates stagnation. Because of its relationship with the gallbladder within the lesser yang, and between the gallbladder's relationship with the liver, triple burner 3 indirectly affects the liver, so that it can be used to eliminate stagnation of liver qi manifesting with hypochondrial pain, depression, and mood swings. On a psychological level, it moves qi and lifts depression deriving from stagnation of liver qi, particularly in combination with do 20. It is extremely effective in lifting the mind when the person is depressed. Next point is GB13. GB13 is a very important point for mental and emotional problems. In combination with Heart 5 and GB38, it is very much used in psychiatric practice for schizophrenia and split personality. It is also indicated when the person has persistent and unreasonable feelings of jealousy and suspicion. Apart from these mental traits, it has a powerful effect in calming the mind and relieving anxiety deriving from constant worry and fixed thoughts. Its effect is enhanced if it is combined with Do 24. Apart from anxiety, GB13 can also be used for depression. In fact, its deep mental and emotional effect is also due to its action of gathering essence to the head. The kidney essence is the root of our pre-heaven chi and is the foundation for our mental and emotional life. A strong essence is the fundamental prerequisite for a clear mind or shen in a balanced emotional life. This is the meaning of this point's name, root of the mind. That is, this point gathers the essence that is the root of the mind or the shen. The kidney essence is the source of the marrow that fills up the brain, called the sea of marrow. GB13 is a point where essence and marrow gather. The Great Dictionary of Acupuncture says that this point makes the mind or the shen return to its root. The root of the mind is the essence, hence this point gathers the essence to the brain and affects the mind. As it connects the mind and the essence, it also treats both the heart and the kidneys, and therefore the mind or the shen and the willpower or qi. For this reason, it is an important point in the treatment of depression. When combined with other points to nourish essence, such as REN4, GB13 attracts essence towards the head, with the effect of calming the mind and strengthening clarity to the mind, memory, and willpower. The connection between GB13 and the essence is confirmed by the text and inquiry into Chinese acupuncture, which has among the indications of this point excessive menstrual bleeding, impotence, and seminal emission. Next point is liver 3. Liver 3 is a major point for depression deriving from stagnation of liver qi. It moves liver qi, stimulates the coming and going of the ethereal soul in depression, and also calms the mind. It has a particularly calming effect when it is combined with Li4. Thank you for listening.